Diabetes is one of the most prevalent chronic diseases in the world today, affecting millions of people. It is a condition where the body struggles to regulate blood sugar levels, leading to health complications if not properly managed. There are two main types of diabetes, type 1 and type 2. Understanding the differences between these two types is crucial, especially as the number of people diagnosed with diabetes continues to rise globally. What is diabetes? At its core, diabetes is a disorder that impacts how the body uses glucose, which is the primary source of energy for our cells. Under normal circumstances, the hormone insulin, produced by the pancreas, helps cells absorb glucose from the bloodstream. However, in people with diabetes, this process is disrupted, leading to high levels of glucose or sugar circulating in the blood. Over time, elevated blood sugar can damage organs, nerves, and blood vessels. Type 1 diabetes, causes and mechanisms. Type 1 diabetes is an autoimmune disease. This means that the body's immune system mistakenly attacks the insulin-producing cells in the pancreas, known as beta cells. The exact cause of this attack is not fully understood, but it's believed to involve a combination of genetic and environmental factors, such as viral infections. Type 1 diabetes usually develops in children, teenagers, or young adults, though it can appear at any age. Once the beta cells are destroyed, the body can no longer produce insulin, which is essential for regulating blood sugar. Without insulin, glucose cannot enter the cells, causing blood sugar levels to rise dramatically. Type 1 diabetes, symptoms and diagnosis. The onset of type 1 diabetes is often sudden, and the symptoms can be severe. Common symptoms include increased thirst, frequent urination, unexplained weight loss, extreme hunger, fatigue, blurred vision, and in some cases, a fruity odor on the breath. Because the body cannot use glucose for energy, it starts breaking down fat for fuel, leading to the production of ketones, which can result in a dangerous condition called diabetic ketoacidosis, DKA. Early diagnosis is essential to prevent complications. Doctors typically diagnose type 1 diabetes through blood tests that measure blood sugar levels, the presence of ketones, and autoantibodies, which indicate an autoimmune attack. Type 2 diabetes, causes and mechanisms. Type 2 diabetes is much more common than type 1 and is often linked to lifestyle factors. In type 2 diabetes, the body becomes resistant to insulin, meaning that the cells no longer respond to it effectively. Over time, the pancreas may also produce less insulin. This form of diabetes is closely associated with obesity, physical inactivity, and poor diet. However, genetics also play a significant role, and having a family history of type 2 diabetes increases a person's risk. Unlike type 1 diabetes, which tends to develop quickly, type 2 diabetes usually comes on more gradually, often going undiagnosed for years. Type 2 diabetes, symptoms and diagnosis. The symptoms of type 2 diabetes can be similar to those of type 1, including increased thirst, frequent urination, fatigue, and blurred vision. However, they tend to develop more slowly and are often less noticeable. Many people with type 2 diabetes are diagnosed during routine medical exams before they notice any symptoms. Early detection is crucial, as high blood sugar over time can lead to serious complications. Doctors diagnose type 2 diabetes using blood tests, such as the fasting blood sugar test or the hemoglobin A1C test, which measures average blood sugar levels over the past few months. Differences between type 1 and type 2 diabetes. Although both forms of diabetes involve issues with blood sugar regulation, there are key differences. In type 1 diabetes, the body produces little or no insulin because the immune system has destroyed the beta cells. People with type 1 diabetes must take insulin for life to manage their blood sugar. In contrast, type 2 diabetes is primarily caused by insulin resistance. And while insulin production may decrease over time, many people with type 2 can manage their condition through lifestyle changes and oral medications before requiring insulin therapy. Type 1 diabetes typically appears in childhood or adolescence, whereas type 2 is more common in adults, though rising rates of childhood obesity have led to more cases of type 2 diabetes in younger populations. The risk factors for type 1 are mostly genetic and environmental, whereas type 2 diabetes is strongly linked to lifestyle factors like diet, exercise, and weight, alongside genetic predisposition. Managing type 1 diabetes. The cornerstone of type 1 diabetes management is insulin therapy. Because the body no longer produces insulin, individuals with type 1 diabetes must take insulin through injections or an insulin pump. Different types of insulin, such as rapid-acting and long-acting, are used to keep blood sugar levels within a target range. In addition to insulin, people with type 1 diabetes must monitor their blood sugar levels regularly using blood glucose meters or continuous glucose monitors, CGMs. Proper diet and regular physical activity also play essential roles in managing blood sugar levels. Managing type 2 diabetes. For many people with type 2 diabetes, lifestyle changes are the first line of treatment. Eating a healthy, balanced diet, rich in fiber and low in refined carbohydrates, can help control blood sugar levels. Regular physical activity improves the body's ability to use insulin effectively. For some individuals, lifestyle changes alone may be enough to manage type 2 diabetes. However, others may need oral medications, such as metformin, which helps improve the body's response to insulin. As the disease progresses, some people with type 2 diabetes may also require insulin therapy. While type 1 diabetes cannot be prevented, there are ways to significantly reduce the risk of developing type 2 diabetes. Maintaining a healthy weight, following a balanced diet, and engaging in regular physical activity are essential strategies. Public health campaigns aimed at educating people about the risks of type 2 diabetes and encouraging healthier lifestyles have been effective in some regions. Screening for prediabetes and intervening early can also prevent or delay the onset of type 2 diabetes in at-risk individuals.